One of the significant drivers for change is that over the next few years there will be a significant increase in older people across the whole of the country. And if we do absolutely nothing, in Scotland we will have to build every 2 years another 600 bedded hospital, and every 2 weeks we'll have to build another 50 bedded care home. And clearly we're not going to be in a position to be able to do that. We have to look really radically at how we deliver services. And when we talk to our patients and our clients, what they really want is to stay well and healthy, living an independent life at home for as long as they possibly can. And that's what this is all about.
It's about partnership working and respect for each other.
The adult social work service will come across to NHS Highland and form part of a new organisation as part of, after the 1st of April. And it's a really exciting time because we're going to be contributing to a far better way of offering care to people who require our services.
We are also viewing it as being a merger rather than a takeover. I think that's important. My colleagues would all say that we want to be part of a new organisation rather than joining an existing organisation.
This is an organisational change, okay, which isn't very exciting to talk about, but it is a key feature, we think, in trying to get people to get the right treatment in the right place at the right time.
We want to make sure that people don't have to fight for the things that they need, and they don't have to put up with lots of people coming through their homes asking them the same questions.
I think we're increasingly recognising their complex needs, and a medical model doesn't solely work in this situation.
Sometimes what happens is that people have simple problems that degenerate and deteriorate so that they become ill enough to be admitted to hospital. We're doing simple things earlier on, helping people out with some simple things day to day, get medical problems sorted out a bit earlier, a bit more social support at home, making sure people are eating enough and drinking enough and doing the right things, can stop them deteriorating so far that they have to be admitted to hospital. One of the things that we do get caught out with from time to time is people get to a stage that they could be managed at home with a little bit of help. They want to be at home, everyone wants to be at home, but realistically, for that period of time until they're fully better, they're going to need a bit of help in the morning, a bit of help in the evening, whatever it happens to be, just to support them at home.
I've got a mother and father who are both in their 80s. They certainly don't want to end up going into care homes if they possibly can help it, and I certainly don't want to when I get to that stage. So I think the more that we do now to try and develop services in the community so that people can live fulfilled but safe lives in the community, that's going to be better for everyone.
We're working with people primarily sort of age 16 upwards from a whole range of backgrounds, whether that's people with a learning disability, people with mental health issues, a very high number of older people who are requiring our services. At the same time, these people also have health needs, and I think in the past we've had almost like a silo approach. You got your health service delivered from one part of the community, you got the social work service from another. And very often though, there could have been a more complementary way of going about things.
We're very clear that the closer the links, the more effective the service we're going to be able to provide for people, and we've probably gone about as far as we can with making links closer without it being a full integration.
By removing the barriers of having two organisations with two separate budgets, two sets of managers, by bringing these people together into a single organisation, we think we'll really be able to drive significant improvements for the people that rely on us.
I think some of the obstacles, the barriers that have maybe stopped us providing the best care will come down. Realistically, that's faster decision making, that's access to resources by the people who are maybe closest to the person, whether that's a nurse or a social worker or a carer. I think all those sort of improvements will come forward from this integration.
I think that people won't notice immediate differences at the front line. In fact, lots of people are telling me that they're already working at the front line in an integrated way, and this will only help them do that more.
I quite often say to service users that the carers coming in to support them are strangers on the first visit only. They then become people who they're familiar with. We're not even going to be in a position where we're going to be strangers to our NHS colleagues. We already know them, we're already working with them, we already have a huge level of trust in their abilities. They have trust in our abilities as well, and hopefully it is the final stage towards making a much better service to everybody.
We've had a fantastic track record over many years of joint working, partnership working with NHS colleagues, particularly at the front line. So the nurses, the social workers, the carers are all used to providing care with each other and to the community.
It's building on good relationships that are already established in some areas and starting off building those relationships for those who have not been able to do that to date.
I do hope, though, that a further step forward is actually going to improve the sort of care that individuals are getting and to break down what was really quite an artificial divide.
For the clients themselves, initially they'll not see a major change. Their care will continue in the same way as it always has.
Ideally, the change of strategy should not be noticed by the patients. It should make the service the way that people would expect it to be. You expect the different people involved with your care to be good at working together, good at communicating with each other and good at telling you what's going on. So if it works well, hopefully people won't notice.
I think there's a potential for fantastic changes to be made. We believe that we can get so much more for the patients, for the public that use our services if we really work very closely together. This will give us the best chance for a generation to do that.
It's a really exciting time. It's embracing this new organisation. It's looking at what we can provide together for our communities.
Everything we do has to be for the benefit of individuals and their families and their friends in a much more personal way than maybe has been possible in the past.
Working with social care is imperative to bring everything together.
We'll be able to access the experts in these areas who will be able to do the job far better than we can and make sure that the patient gets the best care.
Be proud of what we're doing, be part of what we're doing, be aware that we need to be very careful. We work together to make sure we provide high quality services to the people of the Highlands at all times and take responsibility for helping us deliver those services.
I think it's outstanding that Highland has taken a lead on this. Rather than waiting to see what everybody else does, people in Highland have managed to talk down seriously enough to do a difficult thing with two different organisations and decide that it's better for people to work together. People have had to work across boundaries, people have had to work across areas of comfort zones, give up power that they perhaps had to another organisation, and that can be difficult to do, and Highland has really led the way in that. And I think it's Highland should be very proud of taking this step first ahead of the rest of the country.